Hi, this is Dr. Robert Peltier, Chief Medical Officer at North Oaks Medical Center in Hammond, Louisiana, with a weekly COVID update. We've had a lot of questions about yesterday's LDH numbers, and even with our own employees concerned about the significant increase in patients. We went from a little over 6,000 patients yesterday to about 9,000 in the state. Here's what we know about that large increase. One, we know that a lot of tests that have been pending and were backlogged got cleared. On our own national company that we use, Quest Diagnostics, about a week ago they had moved to some better level of testing that had a higher turnaround time, and we saw most of our numbers clear up. The state's website was even a little bit backlogged. In fact, we know that their update yesterday is about half of what we actually know to be correct. Yesterday, their website showed that Tangipahoa Parish had about 42 positive COVID cases. I know for a fact that we have at least 123 as of about 5 a.m. this morning. And it takes a little while because they do confirm all of those tests. They confirm the parishes that they're in. They certainly confirm the number of deaths and to make sure that they're placing them in the right parish, etc. So we know that those numbers are a little bit concerning when we saw from 6 to 9,000. We also know that a lot more tests are getting done, and so we are going to be testing more and more people and finding those people that have very mild diseases. The good news, and on a phone call I had with our state epidemiologist and Dr. Jimmy Guidry, who's the Chief Medical Officer for the Louisiana Department of Health yesterday, along with some of my fellow Chief Medical Officers, they were a little encouraged by the increase in hospital beds and the increase in ventilator cases going up only slightly. They've been much higher over the past few weeks, and we saw only about an 8% rise in hospitalizations and a little over a 3% rise in people on ventilators, which was encouraging that all the things that you were doing out in the public, staying home and staying away from others, is starting to work. Here at North Oaks, we've tested over 700 people. In fact, this morning's count was 781 of them. We still have 100 or so out that are pending those results. It does take about 2 days currently. More and more testing facilities and technologies are coming out, and we're hoping by next week we are able to use our own in-house machine, which will give us just a few hours to turn around test. But unfortunately, as you can imagine, most of those test kits are going to the areas which have much higher caseloads first, but we do hope to get that technology. Of those tests, like I said, we had 123 positive, which leaves about, so far our rate of positive is about 1 in 5 or 20%. Throughout Louisiana, we still have 507 patients on ventilators. And certainly here at North Oaks, we've had our share of COVID patients that have needed to be on ventilators. Unfortunately, we certainly have had some of our patients that have not made it through this terrible illness, but we have also had a number of patients that have come in, been on ventilators, and our pulmonary critical care docs have been able to extubate them, and they are now in the phase of recovery. So we've had a very high success rate of that, and our pulmonary critical care physicians continue to learn new things every day, not only from their own care of our COVID patients here, but more importantly, nationally, that group of physicians has gotten together and shared information, whether that was coming from Seattle, whether that was coming from the New York experience, and where our local pulmonologists have gotten a lot of information from is their experience down in New Orleans at LSU. They have most of our physicians trained at LSU. They have colleagues there, and they have had a larger number of cases and have seen what has been successful and what has not been quite as successful, because this is a new disease, a new way of treating it, new therapies, new ways to ventilate patients, you name it. They keep on top of it, and recommendations keep changing. They change along with the recommendations. So luckily, we've continued to have, on a local level, a manageable level of patients that have come to our facility. We still have surge capability here for those patients that need that level of service. We have in fact converted one of our areas in the hospital to a surge intensive care unit ready for any surge of COVID patients that we have, equipped with ventilators, personnel, equipment, you name it. We have it here in case we get that surge. So we've had a little time more than our counterparts in South Louisiana, New York, or Washington to prepare and be fully prepared and check all our boxes, cross our I's, dot our T's, you name it. We've had a little more time than they have. So we're lucky to have that and thankful to have that, and thankful for the outpouring of thank yous and supplies and those vendors out there and anonymous people who keep sending pizzas for lunch and making jambalaya dinners and having them sent to the hospital for all our personnel. On behalf of them, thank you.
you.